Hey guys, so the past couple weeks we've been talking about lumbar pain and hip pain and really kind of developing a systematic approach for evaluations and also the rehabilitative aspect. So this is just going to be a quick video kind of about my own experiences and maybe some ways that I can really reflect so that I can, look at and identify ideas and areas of improvement. So I think the biggest thing for me is I haven't ever really had a full algorithm for diagnosing low back pain. There's been kind of things that I might look for red flags and such, but I don't really have a specific algorithm. And I think that this past 2 weeks I've been able to do some research and figure out that that is definitely one area of improvement that I need to have. I need to have an algorithm so that I don't miss anything specific. 'Cause I think sometimes just going off of remembering, I do forget things. So, based on that, and also kind of leaning forward with, if we look at the idea of evidence-based medicine or evidence-based practice, there's definitely three criteria or three little subheadings within that. And we might look at, what is science telling us? What's the research telling us? What are our patients telling us? What are their preferences and their goals? And then really clinical expertise. Now, I'm definitely no expert yet, but given my clinical experiences in the past, this might kind of lead me for some decision making. I worked in in a physical therapy clinic, so a lot of the reasoning for specifically in the past, for my evaluation techniques or my rehab has been based on behavioralism. So I have seen, McKenzie exercises, I have seen transverse abdominal exercises, I've seen those things kind of integrate or work for other patients. So I've just kind of used that into my clinical practice now. So, we were really big on McKenzie and we did a continuing education course on it. So I've always used McKenzie and I've seen it work in the past, so I've kind of done it now. Now in the past 2 weeks, I've been able to look at research and see that, hey, McKenzie actually does work. If we're working on kind of lumbar extension, that it clinically and scientifically has shown to help patients. And then kind of on top of that, kind of using a posterior to anterior translation or mobilization has also worked. So I used to do that in my physical therapy clinic, and I would specifically have this one patient that would come in 3 times a week, and he would ask me if I can do kind of a PA mob for him, and he would get substantial he'd get substantial relief from it. So I've kind of used that going into my clinical practice now with not having other physical therapists around me. And it definitely has worked in the past. So I have decided to use it. But now it's been really nice over the past 2 weeks to dive into the research, look into it, and find what works and maybe what doesn't work. Now, I think if we're going to look at overall, we need to make sure that it's aligning with the patient's goals. Now, of course, some patients might be apprehensive. I know for sure a lot of people, if they're having low back pain, they're apprehensive to do extension, especially lumbar extension. So, doing it maybe with them and also then diving into the research and explain that, hey, scientifically, this should help you. Now, 100%, I can't say 100%, but it's worked in the past for other patients, and science is telling us that it's working, so we should continue to try it and make sure that they are comfortable. And that's just a quick little video. I hope you enjoyed, and let me know if you have any questions.